Well, I think there's such a range. You know, when we talk across the country with each other, there's pockets of good in some elements of IF. I think we still see that we don't believe that anybody has it down perfect, that they haven't done it just right. But I think we can see excellence in some support circle models and support network models. I think there's some places that do better in transparency. But I think we still feel that it's just got a lot of growth area.
Yeah, and I think there's a level of frustration across the country. There are jurisdictions that have been doing IF for decades now and still feel like they haven't really got close to having the ideal system in place. And then there are other parts of the country, provinces, that just have really not even entered into the system at all to try to exploit IF. So, and that, I think that's frustrating as well.
And questions why?
Yes.
Why not? What's so hard about it?
Yeah, and I think part of the challenge that we have is that there really is no national leadership on this. That we've got little conversation between the provinces at the government level to try to find to learn from one another and implement consistent policy, and just no action by the federal government to try to fill that void and create provide some leadership. That's what's led to the impetus for this discussion group, the national discussion group that the community launched to bring the provinces together, the people in the who understood this, to have some discussion about what some of the principles and approaches would be that could create some consistency across the country.
So one of the things we did when we got together as a group from across the country is we said, nobody is doing this right. And so why don't we develop some sort of framework that we could go to a government or go to a province and say, if you did it this way, we think you'll have it down pat. And so we created a framework for the effective implementation of individualized funding. It's a document, it's available in both French and English in Canada. And it goes through the core principles of individualized funding that we think are fundamental to the success of it, and then the elements of it. And includes a glossary, an explanation of some of the words. So some of we identified 4 core principles we thought were really important. Of course, self-determination is right at the top of it. That the individual has to be involved and has to be directing it. And one thing we said is that people have to be assumed to have capacity. And I think that's just a fundamental piece there. Quality of life is enhanced when people have control and choice. And I think that's the second one. And then the supports are person-directed, and they're comprehensive, and they focus on what the individual wants out of their life. And then that the role of families and friends and support networks are seen to be a legitimate support for what is done and how the individual is supported to live the life that they want to live.
So there were 6 essential elements that we identified that would be needed. They were eligibility, so some transparency in eligibility for IF, to make sure that all people who needed it, could benefit from it, had access to it, and that there weren't restrictions. That there was clarity in funding, again, transparency in what people were eligible for in funding, how they would access the funding, and what it would cover. That this was backed by good planning. That people had got access to funding that would meet their life plans and be tied to that, and not to an assessment of their disability needs. That there was resource in the systems to support the implementation of IF, both at a broad system level but at an individual level. So for families and individuals who undertook IF, they had the support that they needed to make it work for them. That we really thought it important that there was evaluation of the system as we went along, so that we could learn from it, learn from one another as we tried to implement this across various jurisdictions, and I guess sort of evaluate how well we're doing in actually meeting the objectives of creating a good life for people. And then some clear accountability and thinking about the accountability. So accountability that met the objectives that government requires in it for the use of public funds, of using money wisely, but also making sure that we measured clear outcomes, good outcomes for people. So not just trying to get the cheapest programs that we supports that you can
Right.
can access.
Right. And that the accountability would not be onerous on the individuals, so that the bureaucracy isn't built up too much, but that it definitely focuses on what, the individual said, these are the outcomes they're trying to achieve, how are they getting there, is the funding doing what they wanted it to do, really, so.
Yeah. So what we've been interested to learn as we've gone along here is just where some of these elements may be in place, and where we're making progress in them. And I think this is where we find some variability across the country as well. Is that there are some jurisdictions that have more comprehensive policy frameworks and approaches that help to achieve some of the core principles and that have some of these elements in place. I don't think there's any jurisdiction. There really isn't any. Our measure will be in the end. Are we meeting all of the principles, and do we have all the various core elements in place? And we really don't see that anywhere or close to that anywhere in the country, I think. In the absence of good leadership at the government level to move this issue ahead, I think it's imperative that the community continue to give a place for these conversations to happen and to continue to learn. I think if government were to step in and become better coordinated, I think that probably wouldn't indicate a need for us or a time for us to step back still, but it would give us a new place to take our conversations.